Good morning, I'm Adam Sexton. Thank you for joining us. As America makes steady progress vaccinating its population against COVID-19, an invisible cliff of sorts awaits as eventually all the people who really want the shot will get it. Then a big part of this global struggle transitions to overcoming what is called vaccine hesitancy, a phenomenon that hinders people who might be open to getting the shot from actually getting it for any number of reasons. Here this morning to help us learn more is Dr. Jose Mercado from Dartmouth-Hitchcock. Thanks for checking in, Doctor.
Thank you for having me.
So let's start out by explaining vaccine hesitancy, what it is, and why we're likely to start hearing more about it in the weeks ahead.
Yeah, when I think about vaccine hesitancy, I usually think about three things. I think the first would be complacency. These are individuals who may be feeling a little bit less vulnerable from the disease, and is why they hesitate. The second would be convenience, and this would be individuals who have concerns about the side effects or do not want to experience side effects. And the third would be confidence, and this would be the individuals that just maybe not trust the science, may feel like we've cut corners, or may feel like that the therapy is just too novel. And yes, I think, with the first few phases of the vaccine distribution, we've kind of focused on those high-risk population. And really that's goes back to the limited number of vaccines. But as we have more vaccines and we move towards the healthier population, I think the focus would then shift to addressing vaccine hesitancy, because again, as a reminder, we are in a race to herd immunity.
What role is social media playing right now? I'm curious for perspective here. Is it positive or negative?
Yeah, that's interesting, because I do like social media myself. So it's hard for me to say whether it's good or bad. I think ultimately it is a choice that we make as far as how we use it. I think ideally I would like social media to be less about sensationalism, less about clickbait, because, for example, our marketing and communications team also work hard on putting out information that should help or try to help curb myths and misinformation. But unfortunately, that kind of information does just not, it's harder to make it viral. So maybe if folks like and subscribe, we would be more successful.
Do you think doctors need to be more proactive with their patient group, the people that they see on an annual or biannual basis? I read in one medical journal something that struck me. It was a doctor counseling other doctors saying nothing is actually saying something.
Yes, definitely. And I wouldn't limit that to just doctors. I would say all healthcare professionals, that is part of our role, to be advocates for our patients' health. At Dartmouth-Hitchcock, we've formed a multidisciplinary vaccine allocation group that has really tried to address healthcare inequity and tried to find creative solutions of reaching out to patients who may have social economic barriers.
What is the best way, in your experience, to reach those people who are experiencing vaccine hesitancy? Might be a little bit more on the skeptical side. They say they won't get the vaccine and they aren't going to listen to the experts.
Yeah, I think it has a lot to do with trust in the medical profession. I think the first step is really to be able to listen to these individuals or group of individuals as to what their concerns are, rather than focusing on why they won't listen or they won't get the vaccine. And I think as you align your goals with their interests, we do have several different tools. Education is always a useful tool in highlighting the gaps in our interest or positions versus our actions, meaning, I might decide for myself that I don't want to be vaccinated, but at the same time, advise my loved ones to get vaccinated because I feel that they may be at a higher risk for severe severe disease, I think us as healthcare professionals also need to learn to become influencers ourselves, understand where our patients get their information and use the platforms that they use to get their information. And then maybe third is partnering our patients to someone who trusts the medical profession with a similar background, because I think sharing experiences are very powerful in convincing folks to maybe change their perspective.
I'm interested to hear what you think about this dynamic tension we have in the United States. There's this value of personal liberty, and then there's public health, and it seems like there's been a bit of a clash between those two, as we've seen over the last year.
Yeah, definitely. That's a great question, because I think the pandemic has really highlighted how interconnected and interdependent we are, meaning, the choices that one makes has ramification beyond our own personal lives. And the goal here is to really do as little harm as possible to the community. So, one could think that when an individual makes a personal choice that puts them at a higher risk of infection, that then therefore leads to an increased risk of infection of another individual that may not have a choice. One could question that could that not be a violation of how we value personal liberty?
And on the flip side of that, though, do you think if the government pressed harder and made the vaccine compulsory, that would result in an increase in vaccine hesitancy or vaccine refusal?
I think, yes, the initial response would be that you would see an increase. But I think, similar to what we've seen with our mitigation strategies and how we've observed pandemic fatigue, is that the tendency is for when you tell someone to do something, is that it's only effective up to a certain point. I think we start to ask questions of how and why we should continue to follow those mandates. Hopefully, I think one strategy that we could use is incentivizing vaccination. And I think that's what we've seen with the most recent CDC guidelines around masks for those who have been vaccinated. But in an ideal scenario, I would like for individuals and communities to understand that it's a moral obligation. It's kind of like our social contract in a way to end this pandemic. So hopefully we would make personal choices to be vaccinated without having to have government mandates or compulsion.
How big of a problem is it, in your view, that politics has become such an enormous and pervading part of the vaccine response? I know you guys kind of work miracles up there at Dartmouth-Hitchcock, but this seems like a really tough knot to untie.
Yes, it's really tough. And I think it just goes back to us having that ability to trust the science, trust the public health experts. We need to be able to make informed decisions for our health. And I think sometimes when you try and mix in politics into that, it then creates this atmosphere of mistrust or kind of choosing who to trust. So I think when we make healthcare decisions based on our political beliefs, it can put our own health at risk and again, the community at risk as well.
What's the best way to approach communities of color that experience vaccine hesitancy for reasons that are rooted in historical facts, things like the Tuskegee syphilis study that went on in the 20th century that has caused a lot of African Americans to really distrust healthcare?
Yeah, I think we need to find ways to empower these communities. I think we need to be able to provide them with the resources that they need to take their own initiatives. And I think the other way is really to partner with leaders within the community to find creative solutions that would foster trust.
I'm curious, on the historical side of things, if we sort of take this modern fight over vaccines and transplant it into the past, if we had only reached 65 or 70% of vaccination with something like smallpox or polio, would we still have that around to this day?
Yes, I think that's important. That goes back to how we've defined and achieved herd immunity. So I think the vaccine uptake, as what we've learned in the past, has really been the best way to have that immunity or capacity to break the transmission of infection and protect a community and also prevent severe disease and or deaths.
We do want to touch really quick as we wrap up here on the new COVID long hauler unit that you guys are launching up there at Dartmouth-Hitchcock. Describe, are you looking for people to come forward who are still experiencing symptoms?
Yes, we've had conversations and we have commitments from different specialists who have taken keen interest in helping patients who have long-term symptoms. So hopefully we would have that long hauler clinic set up soon. We're trying to aim for sometime next month, and we will certainly have announcements.
Do we know how many of those people are out there, Doctor?
I do feel like it's underreported. What we've seen in the literature thus far is that about 30% of those who experience severe disease may have long-term symptoms. It's the same for those who have mild symptoms, that about 30% of those patients who have mild symptoms may also develop long-term symptoms. But then I think not all of these patients who experience mild symptoms are tested or are reported.
Dr. Jose Mercado, we thank you so much for joining us on Close Up and providing this great medical perspective.
Thank you.